I'm about to show you something from brand new research published just 3 weeks ago that's going to make you question every blood pressure reading you've ever taken at home. There are 13 critical mistakes that turn an accurate medical device into a source of dangerous misinformation. And mistake number 1, the most catastrophic one that almost everyone makes, can add 20 points to your reading, enough to put you on medications you don't need. Enough to make you think you're having a crisis when you're actually fine. But I'm not going to tell you what mistake number 1 is yet, because if I reveal it now, you'll check if you're making that mistake, and if you're not, you'll stop watching. But you need to know all 13 mistakes. Every single one matters. And by the time I reveal mistake number 1 at the end of this video, you'll understand exactly why it's so dangerous and how to fix it. I'm Dr. Claire Whitmore, and after 2 decades as a cardiologist, I've seen patients end up in emergency rooms, get put on unnecessary medications, and make dangerous health decisions, all because of measurement errors, not device failures, technique errors. And here's what terrifies me most. Right now, somewhere, a senior is looking at a falsely high reading and panicking, reaching for medications they don't need, calling 911 for an emergency that doesn't exist. And simultaneously, somewhere else, another senior is getting a falsely low reading, feeling reassured, ignoring symptoms of a stroke that's about to happen. But before we start with mistake number 13 and count down to the most dangerous mistake, I need you to do something. Comment below what brand of blood pressure monitor you're using. Just the brand name. I'm reading every comment. I want to see what devices people are relying on. Now, let me tell you about a patient whose story is going to reveal mistake number 13. And pay close attention, because this mistake connects directly to why mistake number 1 is so catastrophic. Margaret was 68 years old, retired teacher, meticulous about her health. She'd bought a top-rated blood pressure monitor after her doctor recommended home monitoring. She read the instruction manual, she took it seriously. For years, her readings were perfect, 125/78, textbook normal. She felt great. Everything was under control. Then something changed. Over the course of 1 week, her readings suddenly spiked. 165/95, then 170/98, then 168/96. Margaret was terrified. Was she having a hypertensive crisis? Was her medication failing? She called her doctor in a panic. Her doctor told her to come in immediately for evaluation. At the doctor's office, they took her blood pressure, 128/80. Normal. Margaret was confused, but at home it was 170/98 this morning. How can it be normal now? Her doctor asked her to describe exactly how she was taking her blood pressure at home, and that's when they discovered mistake number 13. Mistake number 13 is taking your blood pressure immediately after physical activity, even light activity that doesn't feel strenuous. Here's what Margaret had changed without realizing it mattered. 3 weeks earlier, her daughter had suggested she get more exercise. Great advice. So Margaret started a new morning routine. She'd walk to the end of her driveway to get the newspaper. Just a short walk, maybe 100 feet. Then she'd climb the stairs back to her bedroom where she kept her blood pressure monitor. She'd sit down and immediately check her pressure. The walk felt effortless. The stairs didn't make her breathe hard. She didn't think of it as exercise. But here's what was happening in her body. That walk and those stairs were activating her cardiovascular system. Her heart rate was elevated. Her blood vessels were dilated for increased blood flow to muscles. Her sympathetic nervous system was engaged. And she was measuring her blood pressure while all of this was still active. She wasn't measuring her resting blood pressure. She was measuring her active blood pressure. And the difference was 40 points. But here's where this connects to mistake number 1, and this is why you need to keep watching. Mistake number 13 causes temporary elevation that resolves when you rest. Mistake number 1 causes permanent measurement error that doesn't resolve. You could rest for an hour and the error would still be there. That's why mistake number 1 is so much more dangerous. But I'm not ready to tell you what it is yet. The fix for mistake number 13 is simple. Before measuring blood pressure, you must be completely at rest for at least 5 full minutes. Not 3 minutes. Not, I feel rested. 5 full minutes by the clock. No walking, no stairs, no carrying groceries, no housework, nothing. Just sit quietly in your chair for 5 full minutes. This allows your cardiovascular system to return to true resting state. Your heart rate normalizes. Your blood vessels return to resting tone. Your sympathetic nervous system calms down. Margaret changed her routine. She'd get the newspaper and climb the stairs. Then she'd sit down, set a timer for 5 minutes, and just breathe. No checking her phone, no turning on the TV, just sitting. After 5 minutes, she'd take her reading. Her pressure went right back to 125/78. The crisis disappeared. It had never been real. It was measurement error. Now comment if you've been making mistake number 13. Comment guilty if you've been measuring right after activity. I want to see how common this is. Now let's move to mistake number 12. And pay attention because this one is going to surprise you. It seems completely unrelated to blood pressure measurement, but it can raise your reading by 10 to 15 points every single time. And here's what's interesting. This mistake builds on mistake number 13, and both of these connect to why mistake number 1 is so catastrophic. You're starting to see how these errors compound. Let me tell you about Harold. He was 74 years old, retired engineer, very precise, very data-oriented. He measured his blood pressure the same way every single morning for 15 years, 6:30 a.m. sharp. Same chair, same arm, same technique. His readings were consistent, 130/80, year after year, rock solid. Then something shifted. His readings started climbing, 150/90, then 155/92, then 152/88. Same time, same chair, same technique. What was happening? His doctor ran tests. Kidney function, normal. Hormones, normal. No new medications, no dietary changes, no obvious stressors. This went on for 3 months. Harold's doctor was considering adding a second blood pressure medication. But before doing that, I asked Harold one simple question. Has anything changed in your evening routine? Harold thought about it. Then he remembered. His primary care doctor had told him to drink more water. Stay hydrated. Good advice for a 74-year-old. So, Harold had started drinking a large glass of water before bed every night. Perfect hydration strategy. Except for one problem. He was waking up every single morning with a completely full bladder. And he was measuring his blood pressure before going to the bathroom. Mistake number 12 is measuring blood pressure with a full bladder. Here's what a full bladder does to your blood pressure. And this is fascinating. When your bladder is full, it creates pressure in your abdomen. This abdominal pressure compresses blood vessels in your pelvis and abdomen. Your body responds by constricting blood vessels elsewhere to maintain adequate pressure. Your sympathetic nervous system activates to help you maintain bladder control. Your heart rate increases slightly. All of this drives blood pressure up. Studies have measured this effect directly. A full bladder can raise systolic blood pressure by 10 to 15 points. Sometimes more in older adults. The moment you empty your bladder, the pressure drops back down. Harold started emptying his bladder before measuring. His readings immediately dropped back to 130/80. 15 years of reliable data almost destroyed by one simple change he didn't think mattered. But here's what I need you to understand. Mistake number 12 adds 10 to 15 points. Mistake number 13 adds 30 to 40 points. If you make both mistakes, you're looking at 40 to 55 points of error. Your real pressure might be 120/75, but you're reading 165/95. You think you're in crisis. You're actually fine. But mistake number 1, which I'm still not ready to reveal, adds even more error, and it compounds with every other mistake. That's why it's number 1. The fix is simple. Always use the bathroom before measuring blood pressure. Make it part of your routine. Wake up, use bathroom. Wait 5 minutes sitting quietly, then measure. This eliminates both mistake number 13 and mistake number 12 simultaneously. Now let's move to mistake number 11. And this is where things get interesting because this mistake seems obvious, but almost everyone violates it without realizing. Let me tell you about Diane, 71 years old, because her story shows how innocent this mistake seems and how much error it creates. Diane measured her blood pressure every evening at 7 p.m. She had a routine. She'd call her daughter at 7. They'd chat for 30 minutes. Mother-daughter bonding time. While talking, Diane would strap on her cuff, press start, keep talking, get her reading, write it down, continue the conversation. She did this for 2 years. Her evening readings were always 15 to 20 points higher than her morning readings. Her doctor couldn't explain it. Different medications for different times of day? White coat syndrome somehow happening at home in the evening? Nothing made sense. Until I asked Diane to show me exactly how she took her evening measurement. She called her daughter, started chatting, put the cuff on while talking, pressed start, kept talking. There was the answer. Mistake number 11 is talking or moving during the measurement. But Diane said something I hear constantly. But I was just talking. I wasn't shouting or upset. I was having a pleasant conversation with my daughter. How could that matter? Here's how. And this is going to teach you something important about what these devices actually measure. When you talk, you engage muscles throughout your throat, chest, and abdomen. You alter your breathing pattern. You change the pressure dynamics in your chest. Even calm, pleasant conversation creates physiological changes. The blood pressure cuff is trying to detect incredibly subtle pressure waves in your artery. It's listening for the exact moment blood starts flowing turbulently as the cuff deflates. Then, the moment flow becomes smooth again. Those moments create specific sounds and pressure changes that the device detects. Any muscle activity, any talking, any movement disrupts those signals. The cuff can't accurately detect what it needs to detect. And here's the critical part. It doesn't fail obviously. It doesn't give you an error message. It gives you a number, a wrong number, usually a higher number. Diane's evening blood pressure wasn't actually higher. Her measurement technique was corrupted. The moment Diane started measuring in complete silence, sitting perfectly still, her evening readings matched her morning readings, 128/78. The mystery was solved. But here's what's important. Mistake number 11 adds 15 to 20 points of error. We're now up to 3 mistakes that if you make all 3, you could have 60 to 75 points of total error. But mistake number 1, which you're waiting to hear about, creates an error that combines with all of these. That's what makes it the most dangerous. The rule is absolute. During blood pressure measurement, complete silence and complete stillness. No talking, no moving, no shifting in your seat, no scratching your nose. Nothing. Sit perfectly still. Breathe normally and quietly. Wait for the measurement to complete. Then you can move and talk. Now comment if you've been making mistake number 11. Comment talking if you've been talking during measurements. Let's see how many people this applies to. We're up to mistake number 10 now. And this one is going to seem technical, but it's actually about basic physics. The physics of gravity and how it affects pressure in your blood vessels. Let me tell you about Thomas, 76 years old, because his story demonstrates just how much this mistake matters. Thomas came to my office absolutely convinced his home monitor was broken. At home, his readings were consistently 115/70. In my office, they were 140/85. 25 points different. He thought his device was defective. He'd bought 3 different monitors over 6 months. Different brands, all gave him the same readings at home. All wrong compared to the office. He'd spent hundreds of dollars. He was frustrated and confused. I asked Thomas to show me exactly how he measured at home. He sat on his couch, rolled up his sleeve, and held his arm straight out in front of him, elevated and unsupported, while the cuff inflated. There, that was the problem. Mistake number 10 is incorrect arm position. Specifically, having your arm at the wrong height relative to your heart. Here's the physics. When your arm is above your heart, gravity works against blood flow. Blood has to fight gravity to reach your elevated hand. This reduces the pressure in the arteries of that arm. The reading is falsely low. When your arm is below your heart, hanging down by your side or resting on your lap in a low chair, gravity helps blood flow. Blood flows downward easily. Pressure in that arm is higher. The reading is falsely high. The difference can be 10, 15, even 20 points just from arm position. Thomas had been measuring with his arm elevated, making his readings falsely low. At my office, we positioned his arm correctly, and suddenly his readings matched what he was seeing at home. His monitor wasn't broken, his technique was wrong. The correct position, and I need you to visualize this carefully because this is critical. Sit in a chair with back support. Rest your arm on a table or armrest so that the middle of the cuff, when placed on your upper arm, is exactly level with the midpoint of your chest. That's where your heart is. The cuff must be at heart level, not approximately, not close enough, exactly. Use a pillow or cushion if necessary to achieve the right height. Your arm must be supported from elbow to wrist. Relaxed, not held up by muscle effort. But here's what Thomas's story reveals about mistake number 1. Even with perfect arm position, if you're making mistake number 1, your reading will still be wrong. Arm position matters, but mistake number 1 matters more. And I'm still not going to tell you what it is because we're only at mistake number 10. 3 more to go, and then we'll get to the big ones. Now let's talk about mistake number 9. This one doesn't just affect your reading by 10 or 15 points. This mistake can create errors of 30, 40, even 50 points. And most people have no idea they're making it. Let me tell you about Ruth because her story is actually tragic. Ruth was 69 years old, petite woman, maybe 5'2", thin arms, small frame. She'd been treated for high blood pressure for 3 years based on home readings consistently around 155/92. Her doctor kept increasing medications, first 1 drug, then 2, then 3. Her pressure wouldn't come down. Her home readings stayed stubbornly high. But Ruth felt terrible, dizzy constantly, weak, exhausted, could barely function. She'd fall when standing up too quickly. These are classic signs of blood pressure that's actually too low. But her monitor kept saying high. When she came to me for a second opinion, I looked at her thin arms and immediately suspected something. I measured her upper arm circumference. 9 inches. The cuff she'd been using was a standard adult cuff designed for arms 11 to 14 inches. Far too large for her. Mistake number 9 is using the wrong cuff size. Here's what happens when the cuff is too big. It doesn't compress the artery properly. It distributes pressure over too large an area. The device thinks it needs to inflate to a higher pressure to detect blood flow. The reading is falsely high. We got Ruth a small adult cuff. Her first reading with the correct size was 118/75. Normal. Perfect. She'd been over-medicated for 3 years, put on 3 medications she didn't need, suffering terrible side effects, all because of wrong cuff size. But the flip side is equally dangerous. If the cuff is too small for your arm, it overcompresses. The reading is falsely low. You might have dangerously high blood pressure, but your monitor is telling you everything is fine. You're not getting treatment you actually need. Most monitors come with markings on the cuff showing the appropriate arm circumference range. Something like fits arms 9 to 13 inches or fits arms 13 to 17 inches. You need to measure your arm at the midpoint between your shoulder and elbow. Get a measuring tape. Measure the circumference. Compare it to your cuff's range. If your arm is outside that range, you need a different cuff size. This is not optional. Using the wrong cuff size makes your monitor worthless. But even with the right cuff size, if you're making mistake number 1, your readings will still be significantly wrong. Cuff size matters enormously, but mistake number 1 matters more. And we're getting closer to revealing it. Let me ask you something now. Of the 9 mistakes we've covered so far, how many are you making? Comment a number. Comment 2 if you're making 2 mistakes. Comment 5 if you're making 5. Let's see how many errors people are stacking up. Now we're at mistake number 8, and this one is subtle, but it creates chaos in your data. It makes it impossible for you or your doctor to know what's really happening with your blood pressure. Let me tell you about Franklin, 72 years old, because his story shows exactly what this mistake does. Franklin measured his blood pressure whenever he remembered. Sometimes 6 a.m., sometimes 11 a.m., sometimes 3 p.m., sometimes 9 p.m., completely random. His readings ranged from 115/70 to 160/95. Wild swings. His doctor looked at this data and had no idea what to do. Was Franklin's pressure out of control? Was medication not working? Should they increase the dose? Add another drug? The data was useless. Mistake number 8 is measuring at inconsistent times. Here's why this matters. Blood pressure follows a circadian rhythm. It's lowest during sleep. It rises sharply in early morning hours. This is called the morning surge. It peaks in late morning or early afternoon. Then it gradually decreases through evening. This pattern is normal, healthy. Your body is supposed to do this. But if you measure at random times, you're capturing different points in that natural rhythm. The variations aren't blood pressure going out of control. They're normal physiological fluctuations. We gave Franklin a simple protocol. Measure twice daily. Once in the morning before breakfast, before medication. Once in the evening before dinner. Same times every day. Suddenly, the chaos disappeared. Morning readings, 125/78. Evening readings, 120/75. Consistent. Reliable. His blood pressure had been fine all along. But here's what connects to mistake number 1. Even if you measure at perfectly consistent times, if you're making mistake number 1, every single reading is wrong by the same amount. Consistent timing helps you see patterns, but it doesn't fix the fundamental error from mistake number 1. The protocol is: choose 2 times daily, morning and evening, same times every day. Within a 30-minute window is fine. 7 to 7:30 a.m. counts as consistent. But measure at those times every single day, including weekends. Your circadian rhythm needs consistent measurement times to give you reliable data. Mistake number 7 builds directly on mistake number 8, and this one frustrates doctors more than almost anything else. Let me tell you about Sandra, 67 years old. She came to her appointment and told me her blood pressure at home was pretty good, mostly. I asked for specifics. She thought it was usually around 130, maybe 140, something like that. She couldn't remember the bottom number. She'd been measuring for 3 months but had no records. Mistake number 7 is not keeping a proper log. Here's the truth. If you're not logging your readings, you're wasting your time. Memory is unreliable. People remember the scary high readings. They forget the normal ones. They approximate. They round. None of that helps your doctor. We need actual data. Every reading, date, time, both numbers, any relevant notes. We set Sandra up with a simple notebook. Date, time, first reading, second reading, third reading, notes. After 2 weeks, we discovered her evening readings were consistently 15 points higher than morning readings. We adjusted her medication timing. Problem solved. But we only solved it because we had real data. And here's the connection to mistake number 1. If you're keeping perfect logs, but every reading has mistake number 1 built into it, you have a perfect log of wrong numbers. Logging is essential, but it only helps if your technique is correct. And mistake number 1 is the biggest technique error there is. Keep a log. Physical notebook or phone app, doesn't matter, but record every measurement. Date, time, systolic, diastolic. Any relevant notes like felt stressed or after argument or forgot morning medication. Bring this log to every doctor appointment. This is medical data. Treat it seriously. Now we're getting into the top 6 mistakes, and these are the ones that separate accurate readings from dangerous errors. Mistake number 6 is about something everyone experiences, but most people don't think affects blood pressure measurement. Let me tell you about Edward, 70 years old. Edward checked his blood pressure every morning while watching the news. He'd sit on his couch, turn on the television, and measure during the morning broadcast. His readings were consistently high, 155/92. He was convinced he needed stronger medication. But here's what was happening. The news was stressing him out. Stories about crime, politics, disasters, all triggering his stress response. Cortisol releasing, adrenaline surging, sympathetic nervous system activating, heart rate increasing, blood vessels constricting, blood pressure spiking. And he was measuring right in the middle of that stress reaction. Mistake number 6 is measuring while stressed, anxious, or emotionally upset. I had Edward measure in a quiet room before turning on the television. His readings dropped to 128/80. 27 points different just from eliminating the stress trigger. But there's a vicious cycle here. Many people measure their blood pressure because they're worried about their blood pressure. The act of measuring creates anxiety. The anxiety raises pressure. They see a high reading. The high reading creates more anxiety. They measure again. It's even higher. More anxiety. More elevation. Spiral. The solution is creating a calm measurement environment. Quiet room, no television, phone on silent. Sit quietly for 5 minutes before measuring. Practice slow, deep breathing. Let your nervous system settle. If you've just had an argument or received stressful news, wait. Don't measure until you're calm. But even in a perfectly calm state, if you're making mistake number 1, your reading will be wrong. Stress management helps, but mistake number 1 is still lurking. And we're getting close to revealing it. We're down to the top 5 mistakes now. And mistake number 5 is one that seems obvious, but almost no one actually does. Let me tell you about Patricia, 73 years old, because her story could have ended very differently. Patricia had been measuring blood pressure on her left arm for 5 years. Readings always good, 120/75. She felt healthy, no symptoms, no concerns. Then, during a routine physical, her doctor measured both arms. Left arm, 120/75. Right arm, 165/100. 45 points different. This prompted immediate testing. Significant arterial narrowing on the right side. High stroke risk. She needed treatment urgently. Mistake number 5 is not checking both arms. Most people have a slight difference between arms, usually 5 to 10 points higher in the dominant arm. This is normal. But sometimes there's a significant difference, more than 15 points. And this can indicate arterial disease. Here's the protocol. When you first start monitoring, measure both arms for 1 week. If one arm consistently reads higher by more than 10 points, use that arm for all future measurements and inform your doctor. If both arms are within 10 points, choose one and stick with it. Check both arms again every few months to make sure nothing has changed. A new significant difference warrants immediate medical attention. But here's the critical point. Even if you're measuring the correct arm, if you're making mistake number 1, that reading is wrong. Both arms will have the same error from mistake number 1. So checking both arms helps you detect arterial disease. But it doesn't protect you from mistake number 1. Now we're at mistake number 4, top 4. And this one creates more misleading data than almost anything else. Let me tell you about Vincent, 68 years old. His readings were chaotic. One day, 125/80. Next day, 150/95. Then, 135/82. He couldn't figure out what was causing these wild swings. Mistake number 4 is taking only 1 reading per session. Blood pressure varies minute to minute. A single reading might not be representative. The gold standard is taking 2 or 3 readings, 1 to 2 minutes apart, and averaging them. We had Vincent take 3 consecutive readings in my office. First reading, 148/92. Second reading, 2 minutes later, 135/84. Third reading, 130/80. His body needed time to fully relax. The first reading was always elevated. We implemented a protocol. 3 readings per session. Wait 1 to 2 minutes between each. Record all 3. Average the second and third readings. Suddenly, everything made sense. His blood pressure averaged 128/78. Well controlled. But here's the critical point. This protocol only works if you're not making mistake number 1. If mistake number 1 is adding 20 points to every reading, taking 3 readings gives you 3 wrong numbers. You average them and get a wrong average. The protocol is always take at least 2 readings, preferably 3, 1 to 2 minutes apart. Stay seated and still between readings. Record all of them. Average the last 2. That average is your blood pressure for that session. We're down to the top 3 now, and these are the mistakes that cause the most significant errors. Mistake number 3 is something many people do right before measuring without realizing it completely corrupts the reading. Let me tell you about George, 71 years old. Every morning, same routine. Wake up, drink coffee, check blood pressure. His morning readings were consistently 20 points higher than his evening readings. Same medications, same sitting position, same everything, except the coffee. Mistake number 3 is consuming caffeine within 30 minutes of measuring. Caffeine stimulates your sympathetic nervous system. It increases heart rate. It constricts blood vessels. It raises blood pressure. The effect can last 30 to 60 minutes. If you measure right after coffee, you're measuring caffeine's effect, not your actual baseline blood pressure. The same applies to smoking. Nicotine causes immediate blood vessel constriction and pressure elevation that lasts 15 to 30 minutes. If you smoke right before measuring, your reading will be falsely elevated. The rule is, no caffeine for at least 30 minutes before measuring. No smoking for at least 30 minutes before measuring. Ideally, measure first thing in the morning before coffee or cigarettes. This gives you your true baseline pressure. But even if you avoid all caffeine and smoking, if you're making mistake number 1, your reading is still significantly wrong. Caffeine avoidance helps, but mistake number 1 is still there. We're down to mistake number 2 now. And this is where I need to tell you something important. Mistake number 2 is so common that 80% of people make it, and it adds 10 to 25 points of error every single time. But mistake number 1, which I'm about to reveal after we cover mistake number 2, is even more common and creates even more error. Let me tell you about Alice, 74 years old, meticulous, organized, followed every rule perfectly. She measured at the same times. She rested beforehand. She sat correctly. She kept perfect logs. But her readings were consistently 20 points higher than what we measured in my office. She couldn't understand it, until I asked her to demonstrate her technique. She sat down, rolled up her cardigan sleeve to expose her upper arm, placed the cuff, and took the reading. There, that rolled up sleeve. Mistake number 2 is placing the cuff over clothing or on a rolled up sleeve. When you roll up a long sleeve, you create a tight tourniquet of fabric around your upper arm. This constricts blood flow. It increases pressure below the constriction. The cuff can't measure accurately. The reading is falsely elevated, sometimes dramatically. But even worse is placing the cuff over thin clothing. People think it won't matter. It matters enormously. Fabric between the cuff and your skin interferes with the cuff's ability to detect subtle pressure changes. The reading is usually falsely high. Alice removed her cardigan and measured on bare skin. Her reading dropped from 155/95 to 132/78, 23 points. She'd been on medication she didn't need, suffering side effects for years, all because of a rolled-up sleeve. The rule is absolute. Always measure on completely bare skin. Remove the clothing entirely. Don't roll up sleeves. Take off the shirt if necessary. The cuff must be in direct contact with your skin, with nothing in between. But even on bare skin, if you're making mistake number 1, your reading is still wrong. Bare skin is essential. But mistake number 1 creates error that bare skin doesn't fix. And now we've arrived. Mistake number 1. The most common, most dangerous, most devastating error in home blood pressure monitoring. The mistake that almost everyone makes. The mistake that can add 15, 20, even 30 points to your reading. The mistake that puts people on medications they don't need or gives them false reassurance when they're in danger. Are you ready? Here it is. Mistake number 1 is measuring without proper back and feet support. Let me tell you about Helen, 72 years old, because her story demonstrates why this is the number 1 mistake. Helen had been measuring her blood pressure for 8 years. She did everything else correctly. Bare skin, correct cuff size, arm at heart level, resting 5 minutes. But she sat on a stool at her kitchen counter. No back support. Her feet dangling, not touching the floor. Her readings were always high, 168/98, on 3 medications. Pressure wouldn't come down. I had her measure in my office. First, I had her sit on the exam table with her feet dangling. 165/96. Then I had her move to a proper chair, back against the backrest, feet flat on the floor. We measured again. 138/82. 27 points lower just from proper positioning. Here's why this is mistake number 1. When you sit without back support, you engage core muscles to hold yourself upright. This muscle activation raises blood pressure. When your feet dangle without touching the floor, you tense leg muscles to maintain position. More muscle activation, more pressure elevation. Additionally, improper positioning affects blood flow dynamics. Your body has to work harder to maintain circulation. The correct position. Sit in a chair with a firm backrest. Lean back so your spine is fully supported. Don't sit forward. Don't sit on the edge. Full back support. Feet flat on the floor. If your feet don't reach the floor, put a stool or box under them. Your thighs should be parallel to the ground. Feet should be flat, not crossed, not tucked under the chair. This is mistake number 1 because it's the most common error people make, and it creates the largest consistent error. Most people measure at a desk or table without proper back support. Most people let their feet dangle, and every single reading is wrong by 15 to 30 points. Helen got a proper chair, full back support, footrest so her feet were flat. Her readings immediately dropped to 135/80. Her doctor reduced one medication. After 3 months of accurate readings, another medication was reduced. She went from 3 medications to 1, all because of proper positioning. Now you know all 13 mistakes. From mistake 13, measuring after activity, all the way to mistake number 1, improper back and feet support. Each mistake adds error. They compound each other. If you're making multiple mistakes, you could have 50, 60, 70 points of total error. Let me give you the complete protocol. The gold standard for accurate home blood pressure monitoring. First, timing. Measure twice daily. Morning before breakfast and medication. Evening before dinner. Same times every day. Second, preparation. Use the bathroom. Empty your bladder completely. Avoid caffeine, exercise, and smoking for 30 minutes before measuring. Third, positioning. Sit in a chair with firm back support. Back fully against the backrest. Feet flat on floor. Use a footrest if needed. Fourth, arm position. Rest your arm on a table so the middle of the cuff is at heart level. Arms supported and relaxed. Fifth, bare skin. Remove all clothing from your upper arm. No rolled sleeves. Complete bare skin. Correct cuff size for your arm circumference. Sixth, rest. Sit quietly for 5 full minutes. No talking, no phone, no television, no movement. Let your body settle completely. Seventh, multiple readings. Take 3 readings 1 to 2 minutes apart. Stay still and silent during each measurement. Record all 3 readings. Eighth, calculate. Average the second and third readings. That's your blood pressure for that session. Ninth, log everything. Write down date, time, all 3 readings, any relevant notes. 10th, share with your doctor. Bring your complete log to every appointment. Follow this protocol and you transform home blood pressure monitoring from confusion into a powerful medical tool. You'll have confidence in your numbers. Your doctor will have reliable data. Now comment and tell me which mistake was your biggest surprise. Comment the mistake number. I want to see which one shocked people most. If this video gave you information that could prevent dangerous errors, share it. Think about how many people are making these mistakes right now, wondering why their pressure is high, getting put on medications they don't need. This information could change their lives. Subscribe because my mission is giving you accurate, reliable health information. And leave a comment telling me how many of these 13 mistakes you are making. Your honesty could help others realize they're making the same errors. Thank you for watching. You now have the complete protocol for accurate blood pressure measurement. Use it. Master it. Get reliable data. I'll see you in the next video.